Hello, everyone. Thank you for joining us. We are talking about body contouring procedures. Tonight, we're going to be doing a Q&A session. You are live with myself, Dr. Deigni. I'm a board-certified plastic surgeon, and I practice in Houston, Texas. We've got our phone number here listed. It's 281-724-3138. So call us during business hours, Monday through Friday, 9 a.m. to 5 p.m. Central Standard Time, Houston time, or just put in your information in the bottom left of the screen here, and we will reach out to you and answer all your questions, give you approximate budgets for the types of procedures that you're interested in having, and also guide you through the process. For all of our out-of-state, out-of-town patients, we will typically start with a virtual consultation. And that's going to allow us to meet virtually and have you fill out your medical history, put in the pictures that you're interested in, that will show the areas that you're interested in having surgery on. And we'll be able to have a productive consultation so we can come up with the appropriate treatment plan for you. So don't be shy. Ask your questions. Go ahead and share the link with your friends and anybody that you know who's interested in having plastic surgery. And let's get this Q&A session started. All right. Hey, everyone. Thank you for joining. Thank you for joining. I hope everyone's doing well. And I hope everybody has gotten over the change in time. For some reason, it's a little bit more brutal for me this year with the daylight savings. Hey, JackStack04, thank you for joining in and thank you for participating. We appreciate everybody who is supporting our TikTok channel, commenting on our videos, and then coming in for your consultations. Absolutely. So today we had a last-minute visit to the office. This person had unfortunately torn her earlobe. You know, she really likes to wear heavy earrings and large earrings. And she woke up 2 days ago and it had torn through her earlobe and she was bleeding. She ended up going to the ER, but after waiting about 6 hours, was told that she needs to see a plastic surgeon and that they didn't fix it. So eventually, long story short, she came in to see us today and we were able to actually take care of her. And that was very sweet of her. She left a wonderful review on Google for us. So we're very, very thankful. 5-star review for us. So that was good. So I got to do a little bit of earlobe repair. And it's interesting too, because this weekend, I was actually called in to do a lip laceration repair. So this young adolescent boy had been playing baseball with his team. And unfortunately, the ball, I think, ricocheted or bumped, hit something, and then jumped up and he wasn't able to catch it and it actually bumped his lip and completely tore through his lip down to the muscle. Even the muscle was torn. So I got to go ahead and help fix that for this young kid. So that was really nice. And did it as a favor because I know the father, who was actually a family medicine doctor. And so he contacted me and was kind of letting me know that he had been reading through the literature and had reviewed some videos and he was getting ready to suture his son. And I was like, just tell me where you are. I'll come by and help you out. So that was really nice. So hopefully he's going to recover well from that. And he's going to be getting his stitches removed this weekend. So if his father needs help, definitely I'll come in and remove those stitches for them as well. But yes, so anyway, so it was a good day today. Had a good time. We had a couple telehealth consultations as well. Like I said, a lot of our patients come from out of town, out of state. And so we've had some people from across the US who had booked their consultations. So Very good. We had somebody from Minnesota. I think the other one's from, well, I forgot where they were from. But we've got somebody coming in next week from Florida. And so it's always nice to be able to meet you guys in person, well, virtually first, and definitely nice to meet you in person as well for your surgeries. To teach, to inspire. Hello, doctor. Hello, everyone. Thank you for joining. Thank you for participating. I appreciate it. Hopefully everyone's doing well. It is Thursday. I can't believe it's already halfway through the month of March. Oh my goodness, time flies. But we're almost done with the week. Weekend's coming up. I do have a wonderful case lined up for you guys tomorrow. I'm going to be talking about it as well tomorrow. Jimena, hey, how's it going? Hope you're doing well. Any questions? So I'll be doing an extended tummy tuck on my patient tomorrow. Usually those procedures last around 2 to 3 hours. It's the same day procedure. They come in and I do the procedure. They recover in the PACU unit and then are able to actually wake up and go home the same day. Okay, good. To teach and to inspire. Very good follow-up question on a tummy tuck. Oh, and another thing too, I do the drainless tummy tuck technique, which allows you to recover a lot easier and gives you a faster and smoother recovery. You don't need any drains when I do the tummy tuck. So unlike other traditional tummy tucks that other plastic surgeons do, I do a more advanced technique where you actually wake up and you don't have any drains at all. Everything's closed up. It makes it a lot easier for you to take care of yourself and also for you to recover. So let me answer your question to teach, to inspire. How do you tell if someone needs muscle repair with their abdominoplasty? Some patients, it's very, very easy to tell on physical examination. You can actually palpate the muscles. You can feel it on exam. I'll examine them. And when it's very obvious, you can actually feel the separation of the muscles between the right ab and the left ab muscles. So I can actually sometimes put my fingers 2, 3, sometimes even more fingers inside, and you sometimes have some type of fullness in that area as well. It's not a hernia because there's no defect in as like a hole, but it is a stretching out of that fascia layer that separates the skin and fat from the inside of the belly. So on physical exam is when we see it. But when I operate, I actually lift up the skin and fat and do all of the procedures that we have to do for the tummy tuck, and then I visualize that separation. So I actually see it. I measure it, and then 99% of my patients actually need it repaired. EBS is saying, hello, I don't see your price for lipo body. Yes, we don't have any pricing on our website or listed, but definitely contact us. And my patient coordinator will be able to guide you and give you an estimate so that you have a budget in mind as far as like what the pricing is. So put in your information in the bottom left of the screen there. Or for you guys on on Instagram and YouTube, just call us at 281-724-3138 or just send us a private message. All right, let's see here. Boss Chick, I did mine 2 years ago. Has it been that long? Wow, that's wonderful. That is amazing. So glad you're doing well. Hope everything's well with your family. You're very welcome to teach, to inspire. Keep asking questions. I appreciate it. I know a lot of you follow me and participate. And we do get a lot of people. Hey, how's it going, Dr. Myslos? How you doing? Nice to see you. The work never ends, my friend. The work never ends. Hope to see you this Sunday. You coming in to play some soccer? It's going to be a wonderful, wonderful weather, if I'm not mistaken. I don't think there's any rain, so let's get some exercise. Gigi De La Cruz, hello. Thank you for joining. Ask any questions, okay? I hope you're doing well. Yes, Boss Chick. Hopefully, if you ever need any other procedures, by all means, come and see us. We are happy to take care of you, as you know it. Cali Dream Queen, hey. Thank you for waving and thank you for participating. Share the link with your friends, with anybody that you know who's wanting to have plastic surgery. We will be happy to take care of them and have them ask their questions. We'll be answering them tonight. I do these live sessions every Tuesday and Thursday, time permitting, usually from 7 p.m. Houston time for about an hour. Thank you very much for the rose, Samantha. Appreciate it. And always happy to educate and help my patients get a better understanding of what the different procedures are, and answer all their questions about recovery, pricing. Well, I don't have the pricing with me, but definitely contact us and my patient coordinator will go through that with you. But anything from recovery, the types of procedures, how to stage your procedures, how to get ready for surgery, what makes you a candidate and not. Always good to be able to answer those questions and help you guys navigate through your transformation journey. Shelly Blankenship Drake, welcome back. Okay, do you offer virtual consultations? Absolutely, we do. We had a few today, which was fantastic. We've got some people who are actually coming in for surgery next week who've gone through that process of getting their virtual consultation done. And so definitely contact us. I just posted a video on YouTube talking about out-of-town patients. So check that out too on YouTube. Our channel is Deigni Plastic Surgery. Like the channel, subscribe to it. It really helps the algorithm and get people involved. So definitely take a look at that as well and explain the whole process. Call us and we will also walk you through everything, okay? Thank you so much, guys, for your comments. And if I don't get to it tonight, I apologize. DM me, post any question on any comments on any of the videos. I will answer those either through a video or just with a direct message as well. All right. Creative Brandy. What is the downtime for a thigh lift? Great question. So usually it's anywhere between 2 to 3 weeks. It depends on what type of thigh lift we do. There's the thigh lift where I keep the incision hidden just in the groin, and it actually takes care of the top part of the thigh because that's where your excess fat and skin lie. But for some patients who have a lot of excess skin that goes all the way down from the groin all the way down to just before the knee, I will extend that incision and it goes further down. And so that recovery is a little bit more extensive. That's going to be more like the 3 week. The shorter scar is like 1 or 2 weeks. Give or take. And then the longer scar usually is around 3 weeks. That's when patients tell me they feel like their legs are no longer heavy and they feel back like to kind of normal. Of course, you're going to continue to improve your results over time. So over 3 months, 6 months, it's going to continue to get even better. But as far as like immediate recovery to feel comfortable, go back to work and things like that, usually it's around 2 to 3 weeks. For a office desktop type of job, you're going to be back to work fairly quickly, usually within a week. You wean off your pain meds and you're doing fine. All right, very good. Where? MSK510 is asking where we're in Houston, Texas. You need it bad. We'll be happy to take care of you. Please contact us. Our phone number is right here, 281-724-3138, or put in your information in the bottom left of the screen. It's the easiest way. Manikia43, thank you for joining us. Don't hesitate to ask any questions that you might have, okay? We are talking about body contouring procedures. I'm a board-certified plastic surgeon, and I practice in Houston, Texas. All right, so Shelly Blankenship Drake, yes, we answered that question. Downtime for a thigh lift, excellent. Let's see here. To teach and to aspire. Okay, next question, follow-up. Any concerns with patients traveling by airplane after a tummy tuck? No. A lot of my patients actually fly in to get their tummy tucks or body lift procedures or mommy makeover. For you specifically, I put all my patients on blood thinners to help minimize the risk of blood clots. And so for those of you who are coming in from out of town, I will adjust the length of time of the blood thinners to take into account the traveling that you're going to be doing to really reduce that risk. But no concerns for my patients who are actually traveling by airplane. I get them in quite often, and they do very well. Ibis, is there a recovery home for your clients out of town? There are some. again, the way I do my procedures is to make your recovery as easy as possible. You do not require a recovery home. You do not require skilled nursing facilities to be able to take care of you after that. Most patients will come either with a friend or their spouse or partner, and they'll stay at an Airbnb or at a hotel, or stay with friends or family if they have some. If you want to go to a recovery home, you're welcome to, but you don't have to. Necessarily. The recovery process is fairly straightforward, and you don't need skilled nursing expertise to be able to do that. Okay, what's the difference between a thigh lift and a thigh-plasty? It's the same thing, creative branding. It's the same thing. A thigh lift and a thigh-plasty are the same thing. It's just different ways of saying the exact same procedure. Just like an arm lift is also known as a brachioplasty. That's just another medical term. So the medical term is thigh-plasty, brachioplasty, and then when we translate that to just layman's term, it's arm lift, thigh lift. So that's all it is, but it's the same thing. Great questions. All right, let's see here. How much for Lipo 360 Therese Allure? Please go ahead and ask your questions. Put in your information. My patient coordinator has the pricing, and she'll be able to reach out to you guys throughout the week during business hours and answer these questions. Most of these body contouring procedures, depending on how many you put together, will range anywhere between $10,000 to around $25,000, depending on the body makeover procedures that you want to get done. So that's kind of like the budget you should have in mind. These procedures are not covered by insurance. All patients pay out of pocket. We have financing options available. 4 of them, including care credits, patient fi, cherry financing, and Alpheon financing. So definitely contact us, and we'll be able to give you some estimates as far as like what you could expect to have to pay. When you get your virtual consultation or come in for your in-person consultation, you will get an exact quote. That quote is good for 6 months. You'll have to book your surgery during that time. Most patients will usually get a turnaround time around 2 to 3 months and get on the books. Some want it much faster, so they will go around 2 to 3 or 4 weeks, depending on whether they're healthy enough. If they're not healthy enough and we have to medically optimize them, it may take about 2 to 3 months to get them to where they need to be, and then we get them on the schedule. Shelly Blankenship Drake is asking, would I need to send pics in advance? Yes, absolutely. So for all of my patients who are from out of town and we're doing, or even out of state, and we're doing a virtual consultation, you fill out your medical history and you send pictures ahead of time through your patient portal. That way it's HIPAA compliant and safe. And that way it gives me time to actually review your chart. And then I have ideas to, have a more productive consultation and discussion, because I want to know exactly what you're wanting to have done. And I can think about what procedures would be great for you. So for example, Christina, okay, I need a tummy tuck. Wonderful. I'll be happy to take care of you. I do the drainless tummy tuck technique. I don't know if you've heard of it, but it makes your recovery a lot faster and a lot smoother. You're able to walk upright within 2 to 3 days. You're off your pain meds usually around 3 days after surgery. And most patients come in to see me about a week after. They're driving themselves to the appointment and off their pain meds and back at work. So it's a great technique, and it really makes your recovery much faster. What I was going to say was, oh, yes, today, talking about Blankenship Drift's question about pics and stuff like that. Yes. My patient that I saw today for a consultation from out of town, virtual consultation, she sent some pictures. And by reviewing her chart, I already had an idea of what type of procedures I was going to do for her. But then in the conversation, I can actually really hone in on those different types of treatments. So without even having talked to her, when I asked those questions to her, she was very, very pleased. She was like, okay, yes, that's what I want to do, blah, blah, blah. So it really helps to generate a more productive conversation for us. So definitely send your pictures. contact us. We'll be happy to do that. Okay. Yes. Okay. Good. Good. You're ready for your mommy makeover. Excellent. Excellent. I know you've been following us. I remember your name. So definitely contact us. We'll be happy to finally meet you virtually and also in person. And we'll guide you through the whole process and get you a beautiful transformation. So let's see here. Tracy is asking, for reconstruction, do you accept insurance? I do not. We do not take insurance. Any reconstruction that we do is paid out of pocket from the patients. So if you want to get insurance to pay for your surgery, what I recommend is that you contact your insurance and ask them for in-network plastic surgeons who will take your insurance and will be recommended and will be able to do your reconstruction. But not everybody, wants to necessarily go with the surgeons that are in their plan. They prefer to, pick their surgeon based on, rapport that they have, before and afters, and just feeling comfortable. So if that's the case, and you want me to operate on you, I'll be happy to. The only thing is I don't take insurance and you'll have to pay out of pocket, but we do offer financing options, and a lot of our patients qualify for that. We've got Care Credit, Patient Fi, Alphion, and Cherry Financing. And charge. Price range for Lipo360. Contact my office. Put in your information in the bottom left there. My patient coordinator, Linda, has all the pricing. The only one that I know of is the one for the for the tummy tuck, the drainless tummy tuck, as that is my signature procedure. It starts around 11,500. Lipo360, I mean, for these procedures, body contouring, for most of them, you want to plan for somewhere around $10,000 to $25,000, give or take, depending on how many procedures you put together. A full mommy makeover could be anywhere around $25,000, even a little bit more, if you really include everything and it turns out to be like an 8-hour surgery, a full day of surgery. So it all depends on what you're wanting to have done. Lipo360 usually around 2 hours is the process, depending on the patients. Everybody's different. There's petite, there's much bigger, there's patients who've had liposuction before, so we also have to take into consideration the scar tissues that's going to be there, whether or not the fat is going to be able to come off relatively easy, or it's going to take much longer. So all of that factors into the pricing. Okay, so Kimberly is asking, how much is the initial consultation? It's $150 for you to book your appointment, whether it's virtual or in person. And so that fee then is credited to your account when you book your surgery, and it counts towards your surgery. So effectively gives you a free consultation. So thank you for your question. Look forward to taking care of you. And if you're out of town or out of state, I'm looking forward to meeting you at your consultation on the telehealth. All right, so let's see here. Okay, wonderful. Asking, how do I get started? Would you, the doctor, know what I would need done, or how? Oh, I'm trying to get to the next part of the question. Well, how does that work? Okay, absolutely, yes. So I'm the doctor. I'm Dr. Deigni. I'm a board-certified plastic surgeon, and I specialize in body contouring procedures. I'm the one who operates on you. So all of my patients, when you look at my before and after pictures, go through my content on TikTok, YouTube, or Instagram, or Facebook, you'll see Deigni Plastic Surgery. That's my office. That's my practice. And I'm the sole plastic surgeon in that office. So I'm the one who's operating on you. When you come in for your consultation, either in person or virtually, you're going to be talking to me. You're going to talk to my patient coordinator as well, but you're also going to have a one-on-one conversation and consultation with me. And then together we'll put together the treatment plan that's going to get you the results that you need to get, okay? And it's based on kind of like what you present with, what areas need to be worked on. So looking forward to it, okay? Put in your information in the bottom left of the screen. That's the easiest way for us to contact you. We'll reach out to you either by text or phone call. We typically try to just call because it's a lot easier to have a conversation and answer all your questions. But contact us. Our phone number is up here, 281-724-3138. We're in Houston, Texas. And this is the website, www.deigniplasticsurgery.com. There's plenty of areas where you can actually message us, text us, send a message so we can book your appointments. Breaking free from 71. Ever do plastics on someone who lost more than 475 pounds? That would be a record. I think I've operated on patients, the most weight they've lost was probably 200 plus pounds. So 475 would be a record. But yes, absolutely. I'd be happy to work on you. As long as you're healthy enough and you don't have any medical conditions that would preclude you from having general anesthesia, I'd be happy to take care of you. We most likely will have to divide and stage up your body transformation procedures because there's going to be probably way too much surgery to tackle all the areas at once. But I've done that on patients, like I said, who've lost over 150 pounds and close to 200 pounds. And we just go step by step. So we want you to heal well, we want you to recover well, and be able to enjoy the results. So please put in your information in the bottom left of the screen there, and we will reach out to you to guide you through the process and get you in for your procedures. Cali Dream Queen, I had a bariatric bypass surgery. Am I still about to have surgery because of the blood thinner? I'm not sure I understand the question. You had bypass surgery, but I don't think you're on a blood thinner, right? Are you saying, can you be a candidate even if you're going to have this drainage tummy tuck and be placed on a blood thinner? Absolutely. I've had plenty of patients who come in after bariatric surgery, either gastric sleeve, bypass, whatever it might be. And usually they lose their weight around 6 months or so and then stabilize. And then they come to see me after they've been cleared by their bariatric surgeon and their medical team. And then I take care of them. And I haven't had any issues with them being on blood thinners. And it's a short period of time. It's just for the first week after surgery so that we can really decrease the amounts of risk of developing blood clots. Maria has a great question. What is included in a mommy makeover? A mommy makeover is a combination of several procedures, and then it's pretty much tailored to what you want. So your mommy makeover will be different than, say, for example, Danielle's mommy makeover or Gabriella's mommy makeover, because you may have different areas that you want to get treated. But it's typically going to be a combination of 2 or 3 procedures. Usually it's the tummy tuck, maybe some liposuction, and then some type of breast surgery. That's kind of like, those are the general areas that women will include in their mommy makeover, but it could be anything else. I've had some patients who've come in and they've had a lipo 360, a tummy tuck, and fat transfer, but the fat transfer was to the labia. So very different than the traditional mommy makeover, but that's what they wanted because they had lost some volume. The lips were wrinkly, and they had lost volume. So they wanted to rejuvenate that area. That's done. I had another patient who came in and we did lipo 360, tummy tuck, and then we did fat transfer to the back of the hands because she felt like the veins and the tendons were too visible and it kind of was betraying her age. So she wanted to have much younger looking hands as well as getting the belly area taken care of, the mons plasty area, and the contouring from the liposuction. So it all depends. So hopefully that answered your question. So the pricing will be based on what procedures you want to include in your mommy makeover. Some women will have a combination of a breast lift and a breast augmentation, either with implants or with fat transfer to the breasts. A lot of women want that natural, modest augmentation, and they go for their own fat instead of going with implants, but we can do either. So definitely there's plenty of wiggle room there, and we can take care of that. So Deborah Marie 668 is asking, what's the tummy tuck price? Finally, that I know. That's the signature procedure I do. I do the drainless tummy tuck. It starts at 11,500, and changes in that will be based on whether you've had surgery before, if we anticipate a lot of scarring, because that changes the time it takes for the procedures. And so facility cost and anesthesia cost vary based on how much time we think it's going to take. But that's usually where it starts, 11,500, and that includes the full pricing. Like I said, the hello, Alma. Thank you for joining us. Facility fees, anesthesia fees, and surgeon's fees. Contact us. Put in your information in the bottom left of the screen there. We will be happy to take care of you. You're very welcome, Christina. Thank you for participating, and thank you for asking. We look forward to meeting you in person or virtually, and we will take excellent care of you. Shelly Blankenship Drake is asking, what is the seroma? Oh, is the seroma risk higher with drainless? Just curious. No, it's not. It actually is not higher, nor is Brittany Marie. Thank you for joining us. Neither is the risk of infection greater with the drainless. It actually decreases the risk of those incidents. So the risk of seroma in the traditional tummy tuck technique is because if you pull the drains too soon, you have that open space where the fluid is naturally pooling and it can't drain out. It's too much for your body to actually absorb. When I do the drainless technique, I actually close up that space so that whatever little spot is open, that fluid that accumulates there, your body's naturally able to absorb it. It's like drinking from a faucet versus going and drinking from a waterfall. There's no way you'll be able to drink from water. It's just overwhelming. It's just too much. Whereas like from a faucet, you can actually enjoy what you're drinking, or a cup. So it's kind of like that. It's too much for your body to actually be able to reabsorb that naturally. That's why you put drains. But when you do the drainless technique, you close up that space to where your body now can naturally reabsorb that very easily. So it really decreases the amount of swelling that you have, and decreases the time of your recovery. It actually allows you to start healing much faster because you start healing the day of surgery instead of having to wait 2 weeks for that fluid to kind of like, keep stripping the drains and pulling that so that your tissues can start healing and touching. You start to heal immediately. So it's a wonderful process. I really like it. And I do it on all my patients. And I use that drainless technique concept on all of my patients on all of their surgeries. Breast surgery, body lift, circumferential, tummy tuck, thigh lift, broad line lift, all of those procedures. Great question. Thank you. Thank you. We've only got one rose. Anybody want to gift us some roses there? Just for the fun. Resilient 57. Thank you for coming back. Thank you very much, Terry. I appreciate it. Cause for the scar behind the ears to itch months after healing. Sometimes feels like an ant bite. Probably from like you're talking about. Thank you very much, Terry. I appreciate it. From an accurate facelift incision. Some of it has to do with your nerves getting back alive, and it's also part of the healing process. It takes usually around 1.5 to 2 years for scar to really mature. So you could have some type of sensation like that as you continue to heal. So, all right, let's see here. Let me answer some more questions. Thank you guys, everybody, for participating. I really appreciate that. Let's see here. You're very welcome, Maria. Please, yes, contact us. We will take excellent care of you. Shelly Blankenship is asking, do you offer Motiva implants? Yes, we do. Geisha Ja 2 is asking, do you do payment plans? Yes, we do. We also offer financing through Alpheon, Care Credit, Cherry, and Patient Fi. But payment plans, we have some patients who will come and pay by money order, cashier's check, or cash, and they'll put their deposits, every 2 or 3 weeks, they'll come into the office and pay, and then make those payments throughout until they actually have paid their entire quote, and then we can move forward with surgery. Everything has to be paid at a minimum 2 weeks before surgery. Mommy makeover, again, like I was telling Maria earlier, the mommy makeover depends on what exact procedures you put in your mommy makeover. And so, hello, Ken, how you doing? All the way from Arizona, huh? Hope you're doing well. God bless you. It all depends on what you include in your mommy makeover package. So it could be anywhere between $15,000 to $30,000. If you have a full mommy makeover with breast, lipo, fat transfer, implants, lift, bra line lift, things like that. If you want arms or thighs, it all depends on what you include in your mommy makeover. So the pricing will vary, but the drainless tummy tuck starts at $11,500. So as you add on more procedures, the price is going to go higher. But that's to give you a range. Okay, so Callie Dream Queen is saying, yes, sir, I was tapping too fast. Okay, you had your surgery a year ago. Excellent. So you should have dropped in the weight and stabilized. So yes, and you're not on blood thinners. So we should be able to take care of you for your body transformation surgeries, your body contouring, not a problem. Okay. Oh, okay. Thank you very much, Jess Morales. When you have gastric bypass, you're not supposed to have NSAIDs. Yes. Okay. So I think that's what she's asked. Perfect. So that's a different mechanism of blood thinning than the blood thinners that I put you on. I don't put you on NSAIDs, but that's true. It all depends on what type of surgery you've had, and there are certain medications that you can't be on. But for the blood thinner that I put you on, it's safe. So it's not an NSAID or anything that is not acceptable after having the gastric bypass. But thank you very much for asking, for clarifying that, Jess Morales. I appreciate it. Era Shay Cooper. Are there options that are safe for diabetics? Absolutely. I operate on type 2 diabetes patients all the time. We just have to make sure that your hemoglobin A1C level is 7 or less. Anything higher than that, we have to get it down, because otherwise you'll be at high risk of not being able to heal your wounds, and we don't want that. So I've had patients who've come in who have type 2 diabetes and their hemoglobin A1C is 9. I've had some patients come in and it was 12 or even higher. That's too high. Even though they'll tell me, oh, my doctor's monitoring it, they're saying I'm good. No, a hemoglobin A1C of 12 is not managed. I'm sorry, that's not managed. I'm not a PCP or a primary care, like I said, physician, or a endocrinologist, but a hemoglobin A1C that is above 7 is not good for you long-term at all. It's going to damage your organs. So you have to get that down. So if you're a type 2 diabetic, but you have good control of your blood sugars and your hemoglobin A1C is 7 or less, we can definitely move forward with surgery. Like I said, I've done BBLs, body lifts. The body lift is a combination of the hip lift, butt lift, and the drainless tummy tuck. So it goes all the way around like a 360 tummy tuck for my patients, and they've done extremely well. Hi, Vicky Aisu. Thank you for joining. Brina Davis, do you have to be off high blood pressure medications? Where's the rest of the question? It's so hard to hit that tiny arrow. There we go. To have a mommy makeover. No. So if you have high blood pressure, we want to make sure that your, thank you for joining. We want to make sure that your blood pressure is well controlled. So you're going to stay on your blood pressure medication. You don't have to come off of it. No. And we can move forward with that. And I have plenty of patients that come in and get their surgeries who have high blood pressure. Where in Houston are we located? We are in the River Oaks area, within the 610 loop, just right by this St. Regis Hotel. But just give us a call. If you're in Houston, give us a call and we will give you the directions, and you can come in for your for your consultation. Vicky Aisu is asking, what is the recovery time for lower eyelid surgery? So that is typically, he'll have some swelling, bruising, usually for about 7 to 10 days. Everybody's different. I just had a patient who came in for her follow-up today. She's 6 days out. Most of her bruising is now light yellow and is blending very well with the rest of her skin tone, and she looks fantastic. By next week, you won't even know that she had surgery, which is beautiful. So the recovery time for lower eyelid surgery is fairly quick. Let's see here. Okay, Christina says, I had cancer and lymph node dissection. Would the tummy tuck affect that? It should not affect it. As long as you're off your any kind of chemotherapy and have been cleared by your oncology team, you should be good to go. I've operated on patients who've had breast cancer and reconstruction and have done well. You're very welcome, Shelly Blankenship Drake. I appreciate you participating tonight, and I'm glad that you find the information reassuring and informative and helpful. Let's see here. A couple other questions. I need to move to Houston and work for you. We definitely have a good time with my team. Okay, question by To Teach and To Inspire. To Teach to Inspire. What is the difference between a Mons lift and a Mons plasty? Which one is lipo? Okay, so again, the Mons lift and the Mons plasty are same terms. It's just the medical term versus the layman's term, kind of like brachioplasty, arm lift, thighplasty, thigh lift. Both may or may not include liposuction. The actual specific treatment that you do for this type of procedure to target that area is based on what you present with. If you have a lot of excess fat, good quality skin, no stretch marks, no excess loose skin and overhang, then liposuction will be fine. And that will be your Mons plasty or your Mons lift through liposuction contouring. But if you have a lot of excess overhang, skin and fat, then we'll combine liposuction with surgical excision or just direct surgical excision for your Mons plasty or Mons lift. So that's it. Tomo is asking, hi, my cousin wants to know, do you use endo lift after your brachial procedures to refine them? I don't use endo lift. I close in multiple layers to really minimize the tension on the incisions and improve the scarring. Geisha Jatu is saying, when can I start a payment plan? After you've had your consultation with us. So you'll come in for your consultation if you're in the Houston area or are able to travel in for your consultation, or you will do a virtual consultation with us. At that point, we will give you a quote, and then you'll know what the treatment plan is specifically for you and what the price is. Then you can start your payment plan and start paying towards your surgery. You want to do it by the end of the year? Absolutely. So contact us immediately so we can understand what procedures you need, make sure that you're healthy enough to be able to undergo these procedures, and then you can start putting your money aside for the procedures. So, okay, so you had the sleeve done last September. Wonderful. So that's 6 months out so far. So you're probably hitting that plateau now. Continue to maintain that weight loss, and then we can do that. Tracy Torres is asking, do you do arm lifts? Yes, I do. It's also brachioplasty, and I do arm lift surgery. I do various types of arm lifts. There's some very limited who have just excess skin and fat here in this area, and I keep the scar hidden in the armpit. The majority of patients that come and see me have excess skin and fat that goes from the elbow all the way into the armpit. So the scar usually will go from the elbow in. And you can see some of those before and after pictures on my TikTok feed as well. Shelly Blacken Drake is asking, do you use Renuvion for skin tightening? I do, in the right patients. You're very welcome, everybody. Thank you. Thank you for asking your questions. And I appreciate the participation. So I use Renuvion skin tightening on the appropriate patients. So if you have some loose skin, but it's not so bad that we need to actually put a scar and remove that excess skin, I'll do some liposuction and then treat that area with the Renuvion skin tightening. Yes, yeah, definitely. All right, you're very welcome. You're very welcome. Thank you for participating. I appreciate that. Okay, so Geisha Ja 2 is saying, can you combine paniculectomy and pay rest of lipo and tummy tuck? You can for those who take insurance. I don't take insurance. So anybody who comes in for their procedures, they pay out of pocket. Now, you can talk to your insurance. Some insurances will actually cover that paniculectomy part of the tummy tuck, but they'll reimburse you directly. I don't take insurance. Our office does not take insurance. So everything that is transacted in our office is done directly with the patient, not through insurance. Okay, so Tomo is asking, can you combine your brachioplasty with your lower body lift? So the lower body lift is a combination of the tummy tuck, the monsplasty, the hip lift, and butt lift. So all the way around the belt line. Can you combine that with the brachioplasty? I can, and I have. It depends on how severe your overhangs are and things like that, because we definitely want to keep the procedures within a reasonable amount of time, and usually it's within 6 hours. But for the majority of patients, I'm able to actually combine both of those procedures. Yes, it will be right in that 6-7-ish hour limit. Sometimes it can go a little bit over depending on the patient. Okay, wonderful. Excellent. Okay, so Christina says, I work in healthcare, work for a plastic surgeon, and she put drains in everyone. Yes, so the old school teaching, and probably still the traditional teaching in plastic surgery, even to this day, is to put drains. But we have to evolve from that. And so I don't do drains at all. The only time I'll do a drain, and I'm still kind of like thinking about it, is when I do a facelift or neck lift, and that drain usually will stay for about 24 hours, max 48 hours, and then we remove it. Arab Bai, what will 480 HP make me if I'm 480 high profile make me if I'm a 36C but very deflated top? Pose. Okay, 480 will be quite large. I think it will probably give you at least a good 2 cups more minimum. But it all depends on what your body looks like, what your frame is like, how tall you are. So those implants vary based on your own anatomy and shape. So we'd have to kind of take a look at that. But at least it will give you at least, I think, 2 cup sizes more than your 36C. So you'll be like a double D or even bigger than that. So it all depends on how big you want to be. Christina is asking, is there a BMI you require the patient for the tummy tuck? Yes, max BMI is 35. So for the majority of these body contouring procedures, your max BMI will be 35. Do you accept the FSA flex spending account as a form of payment? As long as it goes through the card charge, I don't have any reason not to accept it. But it just has to be something that can actually be spent. So like I said, I don't take insurance. So if your FSA is on a card and it runs through for payments, then we should be fine with that. Okay, Shelly Blankenship Drake is asking, how many hours do you feel is optimal for surgery to determine how many procedures are acceptable? The typical timing that we do, and we follow the guidelines for plastic surgery and elective surgery is 6 hours, give or take an hour or so. So 6 hours is typically where we make that determination as to how many procedures we can actually include in one surgery. Okay, so yes, Brown full length is saying, I need a mommy makeover and lipo 360. Is it possible to get both at the same time? Absolutely. Liposuction typically is part of the mommy makeover. So like I said, I was telling one of the, okay, I'll get you a question, Arabi or Arabi. I'm not sure how to pronounce your name. But so liposuction typically is part of the mommy makeover procedure. So yes, you can definitely get that at the same time. So contact us, put in your information in the bottom left of the screen there, and we will be happy to guide you through the process and take care of you. I don't want to be bigger than a double D. I'm 5'4", 145 pounds. So again, exactly. So it depends on what you look like, how much breast tissue you already have. With a C cup, bringing things up, a 45 will be big. But again, we need to see you. You come in, we do some fitting and some sizing sessions, and you get to see kind of like what it looks like and get an idea of, okay, this is too big for me. So it gives us an idea of which range we would go with. I think for you, probably a 300 cc max 350 implants should be plenty. But again, when you come in for your consultation, we're able to actually get a better idea. You're very welcome. Thank you very much for participating. Thank you, Jess Morales. Thank you for participating and for submitting your information. Have a good night, and hope to meet you soon. Yes, and get her done. Bye-bye. All right, you're welcome. Yes, Brian Foley. Happy to take care of you as well. Martinez Munoz is asking, are there any financing options? Yes, there are. We offer 4. We offer Care Credit, Patient Fi, Cherry Financing, and Alpheon Financing. So give us a call. Phone number is 281-724-3138, or just putting your information in the bottom left of the screen here, and we will be happy to reach out to you, guide you through the process, and get you in for your consultations and your surgeries. Thank you guys for participating there and following me on YouTube. Go ahead and ask any questions that you might have, okay? The chat is live, so don't be shy. All right, let's see here. How much is the average cost for a tummy tuck? Terrence Ellis is asking. Great question. It usually starts around $11,500, and that includes facility fees, anesthesia fees, and surgeon's fees. It also includes all your post-op appointments, your scar treatment, and your garments. So give us a call, put in your information in the bottom left of the screen, and we'll be happy to take care of you. You're very welcome, Christina. I'm glad that you participated tonight. And thank you for all your questions. And hopefully we'll be able to take care of you if you're interested in coming in for your surgery. Okay, to teach to inspire is asking, is liposuction included with the tummy tuck? Is lipo included of the tummy with the tummy tuck? Okay, so liposuction is not included when you want to get a drainless tummy tuck. It is an additional procedure. So when we talk about your procedures, what you're wanting to have done, where you want some contouring, if you want contouring with liposuction, we will include that in your treatment plan. But a tummy tuck is strictly skin excision, removing the excess skin and fat, the pannus, fixing the separation of muscles, repositioning your belly button, and for me, I also take care of the fupa and the mons area. But liposuction, which is removing of the fat cells by suctioning, that is a separate procedure, and we can definitely add it to your tummy tuck. Like I said, a lot of patients will come in and do lipo 360 and a tummy tuck, and then that fat that we remove, they'll have it transferred either to the breasts or to the hip and butt area or to the back of their hands to the labia. Some patients may want some fat to the face because they've lost some weight there and things are sinking and they want a rejuvenated look. So I'll do some fat transfer to the face as well. So it all depends on where you want that done as well. But definitely we can add it. Shelly Blankendrake, do you use X-Pearl or pain pump for pain management? I use X-Pearl. So on all of my patients that get a tummy tuck, I use X-Pearl. I don't use a pain pump. I believe the X-Pearl is a lot easier, a lot nicer, and provides adequate, very good pain control for my patients. And it decreases your need for pain pills. Tomo, you're very welcome. Have a good night, and thank you for participating tonight. I appreciate it. Hopefully, you will be taking care of you or your cousin. I'm not sure who's wanting to have surgery, but anybody you want to send, we will be happy to take care of you. Okay, you're out of state, Christina, no problem. We will start with a virtual consultation. Like I said, a lot of our patients come from out of state or even out of town because Texas is really big. So we got people coming from, 6 hours, 12 hours away. When you're still, can you believe it? You're still in Texas. But definitely, we'll be happy to take care of you. Jesse, do you do modifications for reconstructive surgeries? I'm not sure what modifications you're talking about, but definitely there are a lot of patients that come in who need some revision surgeries, and I tailor it and do what needs to be done to get you the results that are best and appropriate for you. So contact us. We'll be happy to take care of you. Do you do any modifications for reconstruction? Can I do tummy tuck and lipo 360 at the same time? Cherie, Texas babe. Absolutely. Yes. So that would be considered a mommy makeover. So it's more than one procedure, but absolutely. I have a lot of patients that come in and get lipo 360 and a tummy tuck done at the same time. And then with that fat that we've removed, we can actually transfer it elsewhere. Hip dips, butt area, breasts, or back of the hand. If they want that rejuvenated face, we can do it, or even the labia. I've done that on patients who wanted some vaginal or labia rejuvenation. Where are you located? Maribel B. We are in Houston, Texas. We are located right by the St. Regis Hotel. Give us a call if you're in the Houston area, 281-724-3138, or put in your information in the bottom left of the screen there, and we will be happy to take care of you. Hello, thank you guys for joining us. And we will be happy to take care of you and get you in for your consultation and your surgeries. Jesse is asking, do you take insurance? No, our office does not take insurance. The majority of the procedures that we do are not covered by insurance. They're considered elective surgeries, and so patients pay out of pocket. But we do offer financing options. We offer 4 of them. Alpheon, Care Credits, Cherry Financing, and Patient Fi. Shazara Ari is asking, do you do PRF? I'm not sure what PRF is. I know what PRP is, that we do. I'm not sure what PRF is. Please give me a little bit more about what that acronym is. I may be blanking out right now. Okay, so Martina Munoz is asking, difference between a tummy tuck versus non-surgical tummy tuck. So the gold standard is a tummy tuck. Any non-surgical tummy tuck, and I don't even know what a non-surgical tummy tuck is, that's a misnomer. But like maybe something like cool sculpting or some type of device that is trying to burn fat and stimulate your muscles and things like that, they'll never get the results that you get with a drainless tummy tuck or a tummy tuck. The tummy tuck is the gold standard. All of these non-surgical techniques are trying to achieve what we do as surgeons with the tummy tuck. So it all depends on what you present with. Some candidates very few, very limited candidates may actually benefit from those non-surgical devices, but the majority of them not. They're just throwing the money away and wasting time and money. You'll be better off coming in and getting your surgical procedure done. Do you take insurance? Whitney is asking. No, we don't. Our office does not take insurance. The procedures that we do are not considered medically necessary, and insurance plans don't cover them. So we have plenty of patients that come in and have insurance, but the procedures are not covered by insurance, so we don't go through insurance. Everything is out of pocket. Tatia, Tiatia, or Tia, I'm not sure how to pronounce it. About how much is a scar revision for a tummy tuck? It depends on what needs to be done. So definitely give us a call. Come in for your consultation, and we'll be able to have a better idea of what needs to be done. I've done revision tummy tucks, full revisions, or just revision of the scars. It all depends on the extent of it. If we need to do a revision of the monsplasty as well, there's plenty of things that go into doing these revisions for me to be able to assess, and then we can tell you how much it's going to be, how much it's going to cost. So it can range anywhere from $1,000 to $5,000. I don't know. It depends on what needs to be done. Nick Knack at Christina. If from out of state, how long does the patient stay in the area after a tummy tuck? Great question. So for our out of state patients, everybody typically will stay anywhere between 5 to 7 days. Usually you'll stay a week. I'll see you about a week after surgery, so within that 5 to 7 day time frame, and then you can go home. You're very welcome. Thank you for your question, Tia. Hopefully I'm saying it correctly. But we'll be happy to take care of you. Like I said, put in your information in the bottom left of the screen. Come in for your consultation so I can examine you, and then we'll give you a quote once I've examined you, so we know exactly what needs to be done. We can do it. If we can do it under local anesthesia, we'll do it on local. If we need to do a full revision of your tummy tuck or whatever it is, the surgery that you had done, then we'll let you know, and we'll give you a quote for that as well. All right, very good. Great questions. Invest with Richie. Do you use exosomes to help with the healing process? So have you considered? I do not. No, I don't use that. Rosarline, hello. What's the age limit for tummy tuck? Great question. There is no age limit. I've operated on patients. Thank you very much for joining. I've operated on patients in their 40s, well, 20s, 30s, 40s, 50s, 60s, and 70s, and they've done extremely well. It all depends on patient selection. So your overall health is what matters. It's not your age. So that's not a limitation. As long as you're healthy enough to undergo these procedures, we can go ahead and move forward with surgery. So definitely give us a call or put in your information in the bottom left of the screen there, and we will be happy to guide you through the process, get you in for a virtual consultation if you're out of town, out of state, or even out of country, and then we'll start the process and then get you on the books for your surgery. Pricing, everybody, please contact us, and we will be happy to discuss the procedures in more detail. We need more information. Everybody is different. So, for example, Vicky Aishu is asking, how much is it for lower eyelid surgery? It all depends on what needs to be done. Some patients need a lot of fat transfer in addition to the surgery from the eyes. We need to see what needs to be done. Some people in their lower eyelid surgery need a reconstruction of the lateral canthus, the edge, the outer part of the lower eyelid. Everybody's different. So our lower eyelid surgery is not, everybody's getting the same thing. The price will depend based on what you specifically come and present with, and we'll do it. So contact us. Schedule your consultation, come in for a virtual consultation or in-person consultation, and we'll be able to give you a quote and let you know how much your surgery is going to cost based on what you present with. Pretty Brown Eyes 48. Can you do virtual consultations? Absolutely. We do virtual consultations for all of our patients who are not in the Houston area or can't come in person for their consultation. Definitely, yeah. And it's $150 to book your consultation, whether in person or virtually. And that $150 will then be credited to your surgery. So when you book surgery with us, you will get that $150 credit. So pretty much it makes your consultation free. And we are happy to take care of you. We get plenty of patients that come in from out of town, everywhere in the Texas area, as well as other states. So, and all over the US. Excellent, excellent. All right. I think we're going to wrap it up here. I do have to get ready for tomorrow. I have a great case tomorrow. It's going to be an extended tummy tuck. I can't believe the surgery's here. She is a patient. She's follows us on TikTok and has been participating on TikTok for probably over a year now. And I can clearly remember even one time last October, she was commenting on how excited she is about her surgery. And tomorrow is the day. It has arrived. So we'll be doing an extended tummy tuck. Stay tuned. I will be talking about it and displaying that as well. I will do some videos of the beginning part before we operate, just to show kind of like the area, and then post that on TikTok as well. I know TikTok is a little bit sensitive about community guidelines and what we can and cannot show, and I just don't want them to censor things or ding me for that. So I do a lot of educational videos, before and afters, whatever goes through, you'll be able to see on my TikTok channel or Instagram, or also on my website. But definitely when you come in to see us in the office, we also share pictures with you. So perfect. All right. Thank you so much, everybody. If I didn't get you a question tonight, I apologize. Contact us. Put in your information in the bottom left of the screen there. We will be happy to take care of you. There she is. Hello, Laura. See you tomorrow, bright and early. We'll take excellent care of you, okay? And so, or write down the number 281-724-3138, and we will be happy to accommodate you and take care of you. Have a good night, everybody. God bless you, and stay safe. Bye-bye. Thank you very much, everybody on Instagram. I appreciate you guys participating. Have a wonderful night. All right, YouTube fans, thank you for participating. I appreciate it. Have a wonderful night, and until next time, bye. Subscribe to the channel, like it, and send it to others too.